WHO, the World Health Organization, has revealed over 60 million people in Africa have hepatitis B, accounting for over 60,000 deaths annually. Beyond the high cost of treatment drugs, the drugs are less accessible and come with many side effects. Fortunately, some Ghanaian scientists are exploring cheaper sources of treatment that are less toxic and readily available. They have successfully been able to completely cure a hepatitis B patient with a locally made FDA-approved anti-malaria drug known as Nebima in a finding contained in the journal Scientific African.
Individuals with chronic hepatitis B infection are at risk of liver disease and a type of liver cancer known as hepatocellular carcinoma. Fortunately, hepatitis B screening, vaccination, and treatment are increasingly available in many government and private health facilities. 3-dose vaccination costs 40 Ghana cedis per dose. If infected, the medication for the 6-month treatment also costs 80 Ghana cedis per month. These costs are not covered by the National Health Insurance Program, and of course, many can't afford. Professor Mohammed Mutucello is a virologist at KNUST and member of the research team.
Currently, for hepatitis B, for chronic hepatitis B viral infection, there are an array of drugs approved for treatment and management. There are 7 of them. In this country, currently, what is largely used is tenofovir. And these are what we call directly acting antivirals. There are others as well, like the interferon base, which are also expensive. Both tenofovir and interferon based drugs are quite expensive. For instance, the tenofovir that's largely used, the person has to buy it. Then normally they are prescribed together with hepatoprotective drugs such as hepatovites for 6 months. And when we worked out, you would be spending approximately, or at least 1,000 Ghana cedis for the first 6 months, and they have side effects.
Nebima is a plant commonly found in the Kwewu Mountains. It contains a substance known as cryptolepin, which has been found to be effective against malaria and recently COVID-19. Reverend Professor Charles Ansah of the Department of Pharmacology, KNUST, has been working on cryptolepin for some time now.
But that is not the only action of cryptolepin. I call it a wonder drug. It is used in inflammation. It is an antibacterial agent. It is an anti-cancer agent. It is an anxiogenic, and a lot of other properties of this particular plant. So if you are using it for a particular disease, we also know that these are some of the properties of the plant.
Professor Mohammed Mutucello and his PhD student Seth Ejie-Dumfe initially found the success of cryptolepin against hepatitis B virus in a test tube experiment. To translate the findings into clinical care, a 49-year-old male patient with a history of chronic hepatitis B infection was given Nebima for 6 months in a case study. The viral load, blood, kidney, and liver functions were assessed. After 6 months of Nebima therapy, the hepatitis B viral load of the patient reduced by 99%.
And so we thought that the government should probably come in to assist us with a clinical trial before this can be rolled out. You know, this is an FDA-approved drug for malaria.
Happily, the scientists found no reported defects in the blood, liver, and kidney functions within the 6 months of Nebima therapy. Seth Ejie-Dumfe is lead scientist.
And we look at the markers, and they all fall within their ranges. We have normal range that have been accepted. So the values where they are measured at baseline 3 months to 6 months, they were within their normal ranges, which means that the drug had no effect on the kidneys, on the liver, and also on the bone marrow.
So there you have it, an affordable and easily accessible treatment for hepatitis B. However, do not abuse. I'm Dr. Netta Pastram reporting for Joy News.